And joining us for more on all this, Andrew Hantel joins us tonight. He's an oncologist at the Dana Farber Cancer Institute. Dr. Hantel, thank you for joining us. And I know, unfortunately, you have lost patients because of a shortage of drugs in the past. But in the interest of time, let's cut to the chase on this. What are the solutions that you can think of? Is it just as simple as taking the profit motive out of some of the drug production in this country?
Well, I think we have to think about it both in a short-term and a long-term view. In the short term, while all of these things are happening in the private sector, like trying to incentivize companies to make more drug and trying to pass legislation to both import drugs and to find greater solutions, we need to have research to figure out how both to allocate the drugs to patients when there's not enough and to manage shortages more generally. So I think it's both that there needs to be research done and there needs to be these different profit incentives for companies to increase the manufacturing.
So what is the best way to achieve that? Is it congressional action? Is it, I mean, there's disclosure as well, I would think, that has to be addressed?
Of course, yeah. So I think from the private sector standpoint, there needs to be incentives in terms of contractual obligations from hospitals who are buying medications, like was mentioned in the report, for them to maybe be willing to increase the amount that they're willing to pay for a medication. And I think there also needs to be a quality incentive. Right now the issue is both that there is an incentive for companies to get into the market, but there's also an incentive for them to produce high-quality medications. And so very frequently, the supply chain and the quality of the medications is disrupted, and therefore the one or two manufacturers for a medication aren't able to continue making it. And so I think, putting money forward for companies to be able to continue to do that is important. And I think, yes, congressional legislation has happened. It reduced shortages in 2011, and further needs to happen to be able to reduce shortages further.
Sue mentioned disclosure. I mean, if one hospital has a shortage of a particular drug, patients do have choices that they can make to go elsewhere for it, right?
They do, and like the patient in your story mentioned, physicians very much want to talk to patients about it when it happens and when shortages really affect their care. Shortages can be both of medications that we have very good alternatives for, and so a shortage may not actually mean too much in terms of a patient and patient outcome standpoint. But also, you're right, from the hospital perspective, it's not very nice to be the first person coming out and saying our hospital is dealing with shortages when there's a lot of competition in that market. So I think there needs to be an onus on physicians and on hospitals to be able to say this is a really big problem, and there needs to be a lot done on our side, on the health system side, on the pharmacy side, and on the congressional side to do things.
Dr. Andrew Hantel with Dana Farber Cancer Institute. Again, thanks for joining us tonight, Doctor.
Thank you.